Hi everyone. This quick unit is going to be how to use the AED. I will go slowly so I can show you the step by step. During most of this video, the focus will not be on me, it will be on our victim and how to use the AED. So if you're ready, let's get started. When you first arrive with the AED, you will be holding the carrying case. Put the case immediately next to your victim by head and shoulders and unzip or open up your AED. Some AEDs power on immediately, ours and other models do not. So you're going to take the AED device and you're going to set it next to the head and the shoulders of the victim. Normally, I would immediately press the green button, which is the power on. But for right now, I'm not going to because you would not be able to hear me. So I would open the case, set the device down, and then I would power on immediately. The second thing that you need to know is that if it doesn't power on and you do not hear the tape recorded message telling you what next to do, you keep pushing the button until you know that the AED machine is on. Next, I need to make sure that I prepare the chest. Most people are going to have clothes on. You need to remove the clothing and push it off to the side or cut it so that you have a completely bare chest. If it is a female with a brassiere on or anything hindering the chest, take the scissors and cut, but you should have a completely bare chest to work with. For those that have a hairy chest, you're going to need to shave the area above the breast tissue, chest tissue, and you need to shave the hair off to the side on the victim's left. Make sure that you have a bare chest. Next, once we have that, we're going to go back to our packet and we need to get our adult size patches. Take them out of the package, push the package off to the side, and now you will begin to notice that you have two patches. As in the previous video, it is imperative that you put the patches where the diagram tells you to. So the first thing you're going to do is you're going to peel the backing off. It will be sticky for our class. Then this one indicates that it is going to go on the right hand side of the victim. We need to find the person's collarbone and we are going to go directly underneath it and above the chest. Make sure that the pad is securely on. The other pad we go ahead and we peel back, and you will notice that it says to go underneath the chest. So you are going to be going underneath the chest or breast tissue, and you are going to place that on the side by the ribs and underneath the breast tissue. Then you will take the connecting cables, which always seem to get tangled, and you will go ahead and you will put that in your AED device. The entire time that you're doing this, the AED machine will be prompting you as to what to do. The next thing that it's going to tell you once it is connected is that they want you to clear the victim. So you will say, clear the victim, everybody. What is happening is the AED is sensing what kind of rhythm, heart rhythm is happening. If there is an abnormal rhythm, the AED machine will alert that there is a shock advisory. And that means that it is going to start amping up to get ready to shock the victim. So it will tell you, shock advised, clear the victim. You should say, clear the victim, everybody, stay away. You, as the AED person, need to make sure that from around the head and shoulders, all the way down to the feet on your side. No one can be touching the victim. Should anybody, including yourself, be touching the victim while you press the shock button, you will be shocked. Now, please keep in mind that you, the person who is going to administer the shock, you will not be shocked by pressing the button. You would only be shocked if you touched that victim. So the AED is going to advise shock. It will tell you, clear the victim. Then you go ahead and make sure. When it tells you to shock, it will say, press the shock button. Before you do that, you need to do a clean sweep. Push everybody away. Be sure that all the way around. And then when you're ready, you're going to press that orange button. It will shock the victim. The victim's body will kind of jolt up a little bit. Or it may tell you that there is going to be no shock, and it will have you continue doing CPR. At this point, this entire time while you've put your pads on, hooked up this machine, another rescuer will be constantly doing CPR, so you need to work around them. If there is no shock advised, your other rescuer will be continuing to do CPR. We do 5 cycles, and then for 2 minutes, and